Hi, everyone. Thanks for coming out to today's COVID information webinar. We're going to wait another 5 minutes for people to file in. Thanks for being here today. I think while we wait for the next minute or two for people to join, maybe we can do introductions. My name is Emma, and I'm Media and Communications Specialist with Starting Over Inc. And I'll pass it over to Danielle.
Hi, everyone. My name is Danielle. I'm with Riverside County Public Health. I'm a program coordinator, and I'll introduce you to Kevin.
Hi, everyone. My name is Kevin. I'm a registered nurse with the RUHS Public Health Immunizations Program, and I'll go ahead and pass it on to Jasmine.
Hi, everyone. My name is Jasmine Chagoya, and I am a volunteer with Riverside All of a Sudden.
Thank you, guys. So we'll have time for questions at the end, but if you have anything that comes up that you want to make a comment on or ask, feel free to use the chat function or the Q&A box at the bottom. And we'll be monitoring it if you got any questions.
Hi, good morning, everyone.
Okay, let's go ahead and get started. I'm gonna pull up the slides, and do let me know if you have any problem seeing or hearing the slides in the audio.
Everyone, my name is Danielle Lee. I'm with Riverside County Public Health. Hi, good morning, everyone. My name is Danielle Lee. I'm with Riverside County Public Health Immunizations Department, and I'm accompanied by Kevin, who is an RN who will answer any questions you might have that arise from this presentation. It is our pleasure to be here today to provide additional understanding about COVID-19, vaccinations, post-COVID, and COVID-19 treatment options. To provide a deeper understanding of the coronavirus, also referred to as COVID-19, coronaviruses are a type of virus with a crown of spike proteins sticking out, as referred to in this picture provided on the left of the screen. There are many types, including SARS, MERS, and viruses that cause colds. SARS-CoV-2 is the specific coronavirus that causes COVID-19. COVID-19 causes respiratory symptoms, but can also harm other parts of the body. Now let's discuss the COVID-19 vaccines. A few frequently asked questions we receive regarding the vaccine are, how do vaccines prevent illness? What are some reasons a person might get a COVID vaccine? How safe and effective are vaccines against COVID? COVID-19 vaccines help the body to develop immunity to the SARS-CoV-2 virus. They provide strong protection against serious illness, hospitalization, and death. side effects are generally mild, and vaccines are very safe and effective. There are currently 2 COVID-19 mRNA vaccinations, which include Pfizer and Moderna. These mRNA vaccination enable cells to produce spike proteins using the instructions from the mRNA. Immune systems build antibodies to fight against the spike proteins. So in the event if a person is exposed to SARS-CoV-2 later, the immune system remembers the spike proteins and can quickly build antibodies against it. This flyer provides a deeper understanding on how mRNA COVID-19 vaccines work. Coronavirus, like the one that causes COVID-19, are named for the spike-like proteins on their surface called spike proteins. These spike proteins are ideal targets for vaccines, as seen in the provided picture. Messenger RNA, also referred to as mRNA, is the genetic material that tells the body how to make proteins. The vaccine is made up of mRNA wrapped in a coating that makes delivering easy and keeps the body from damaging it. This vaccine does not contain any virus, so it cannot give you COVID-19. It cannot change your DNA in any way. How does the vaccine work? The mRNA in the vaccine teaches the cells how to make copies of the spike proteins. If you're exposed to the real virus later, your body will recognize it and know how to fight it off. After the mRNA delivers the instructions, the cells break it down and they get rid of it. When your body responds to the vaccine, it is sometimes causes symptoms like mild fever, headache, or chills. This is completely normal and is a sign that the vaccine is working. COVID-19 protein subunit vaccinations. Vaccines from Noravax are a protein subunit vaccine that contains harmless copies of the COVID-19 spike protein. This vaccine is different than the mRNA vaccinations. The vaccine from Noravax contains an ingredient called adjuvant, which helps the immune system respond to the spike proteins. Immune systems build antibodies to fight against the spike proteins. If a person is exposed to SARS-CoV-2 later, the immune system remembers the spike proteins and can quickly build antibodies against it. No vaccine is 100% effective, but people who are up to date with their COVID-19 vaccine have a lower risk of severe illness. The attached flyer provides a deeper understanding of protein subunit COVID-19 vaccines and how they work. As previously discussed, coronavirus, like the one that causes COVID-19, is named by its crown-like spikes on their surface called spike proteins. These spike proteins are ideal targets for vaccines. What is a protein subunit vaccine? Protein subunit vaccines are a type of vaccine that cause harmless copies of the COVID-19 spike proteins. These vaccines do not contain the entire virus. The vaccine does not contain any live virus, so it cannot cause you to get COVID-19. What is in the vaccine? The vaccine contains virus pieces called spike proteins and another ingredient called adjuvant. How does it work? When you are vaccinated, nearby cells pick up the proteins. The immune system recognizes that the proteins do not belong. The adjuvant helps the immune system produce antibodies and activate the other immune cells to fight off future infections. Once vaccinated, our body recognizes the protein should not be there. Antibodies will fight the virus that caused COVID-19. Again, when your body responds to a vaccine, it sometimes causes side effects such as fever, headaches, and chills, and these are completely normal and mean the vaccine is working. Vaccine recommendations for age group. Moderna and Pfizer's 2024-2025 COVID-19 vaccines are available for everyone ages 6 months and older. Noravax 2024-2025 COVID-19 vaccine are available for everyone ages 12 years and older. Let's discuss post-COVID conditions, also referred to as long COVID. Long COVID is broadly defined as signs, symptoms, and conditions that continue or develop after initial COVID-19 infection. Symptoms are present 4 weeks after the initial phase of infection. Long COVID is not one condition. It represents many potentially overlapping entities, likely with different biological causes and different sets of risk factors and outcomes. Long COVID prevention measures include the COVID-19 vaccination, as well as oral antiviral treatment. Paxlovid has been linked to lower the likelihood of getting long COVID. There are many symptoms that develop from long COVID, but the most common symptoms include fatigue, headache, brain fog, depression, poor sleep, shortness of breath, and chest pain. Unfortunately, there are currently not any approved medications for long COVID, but healthcare providers can provide care to reduce symptoms of long COVID. For most people with long COVID, the goal of medical management is to optimize function and quality of life. COVID-19 treatments. COVID-19 treatments, also referred to as oral antivirals. What are oral antivirals? Oral antivirals are pills that stop the virus that cause COVID-19 from making copies of itself in your body. 2 oral antivirals are available. Paxlovid, which is for adults and children 12 years of age and older. Lagevrio is for adults 18 years and older. A few commonly asked questions regarding oral antivirals are, what is the time frame I should start taking oral antivirals? Both Paxlovid and Lagevrio should be started from the first day of symptom onset up to day 5 of symptom onset. How do you get an oral antiviral? Oral antivirals are available with a prescription from a healthcare provider, and Paxlovid may be prescribed by a state licensed pharmacist. Patient assistance programs for COVID-19 treatments are available. There are 2 patient assistance programs offered through Pfizer. There's a Pfizer co-payment savings program, which is for privately insured and commercially insured patients, where the payment can be as low as $0 for a co-payment savings program, but you must sign up for this. Additionally, the U.S. government patient assistance program called USG PAP, which is operated by Pfizer, is also available for patients who are uninsured and underinsured with public insurance are eligible to use this USG PAP operated by Pfizer to receive Paxlovid at no cost. Underinsured patients with high co-payments for Paxlovid and cannot afford the medication are eligible. Eligibility for uninsured and underinsured patients is also based on household income at or below 300% of federal poverty level. Lagevrio also offers 2 payment assistance programs, one being a co-payment savings program, which is for privately insured patients to save on their out-of-pocket cost for their prescription. Additionally, they offer a patient assistance programs for patients who are suffering financial hardship and would not be able to afford the medication otherwise. All of these patient assistance programs, including Paxlovid and Lagevrio, require applying for the program prior to getting the prescription. Let's discuss a few resources. RUHS Public Health has a few websites covering all of the information I have discussed today. The QR code on the left of the screen goes over any upcoming clinics that we have scheduled for the community. By scanning the QR code or by clicking on the attached link, will take you to the website. When you scroll down to the bottom of the page, you'll be able to see the location and times of the clinics that we have available, along with the vaccines that we will be providing to the community. The QR code on the right of the screen goes over additional details surrounding post-COVID treatment options. You can either scan the QR code or click on the link provided for post-COVID treatment options. And last but not least, RUHS Public Health has a COVID-19 treatment options webpage that discusses the treatment options and available resources in greater detail. By scanning the QR code or clicking on the link provided will take you to the website and go over specific details surrounding COVID-19 treatment.
Okay.
On behalf
Thank you so much, Danielle, for that amazing presentation. Now, before we get into questions, we're going to hear from 2 community members and starting over staff members on their experiences with COVID, the vaccine, and some ways that we can take steps to ensure that we're protecting ourselves and each other from getting COVID. Because as we heard, there are resources available for people who are underinsured to get vaccinated, which can help prevent severe illness. But another great way to keep ourselves and others safe is to prevent getting COVID in the first place. And that's why Starting Over has masks, including N94s and N95s, and also hand sanitizer available at the office. Because we're also still going through a long flu season. So masking, especially in public places, is still highly beneficial, just even from getting like a regular cough. So we want to encourage people to keep protecting yourselves from airborne viruses in that way. And also some of the masks that we have, like the seal, like the N95 and N94s, which can be like behind your head or behind the ears, are much more effective than just like the blue surgical masks. So we encourage you to use those if you can. But yeah, now we're going to hear from Lee or Jasmine. Would you like to go first?
I'll go first. Thank you, Emma. I appreciate the time. This is something I'm very passionate about. Since I've been with Starting Over Inc. for 3 years now, and I've been masking up for 3 years. Okay. On a personal note, my wife has an immune deficiency, so I mask up to keep her safe. And what I like to say jokingly is I mask up out here so I don't have to mask up at home. Okay. We also we do our vaccinations, and I keep up on that. Also, that's something I'm very passionate about. And my position as Housing First co-director and case manager supervisor, I talk to a lot of participants on a regular basis. And whenever somebody talks about, I get a lot of flack from people that say, "Well, you don't know what's inside that," or people talking about how they want to keep their bodies natural. Let's just say, and 100% of the people have said this to me are either smoking cigarettes, or eating preservatives, or doing these other things, or the fact that all the prison ink we have on us, none of that was regulated. Okay, so it starts to take away some of these arguments. But I'm a big believer in not only vaccinating for myself, but more importantly, the people around me and my loved ones. Thank you, Emma.
Thank you so much, Lee. Yeah, one of the most important things to remember is that we mask and vaccinate so that the people who have weakened immune systems and aren't able to get that protection themselves then can be protected. And one of my close friends who was in the hospital for a brain injury for a while, when we would go to visit her, everyone there would ask that we masked up and were vaccinated. And because we all were practicing safe COVID measures with her, we were able to make sure that she never got infected with COVID while she was in the hospital. So it really takes all of us to make sure, that if COVID is here to stay, that we're all taking every measure that we can to keep ourselves and also our loved ones who can't get the vaccine safe. So thank you so much for that, Lee. Jasmine, I will pass it to you.
Thank you, Emma. Yeah, I agree with what Lee said too. I got vaccinated in 2021 when it was first coming out. I remember for me it was mandatory because I was a undergrad at UCR. I was also living there, so one of the requirements at UCR to attend class or even live on campus was to get vaccinated. So I did right away. To do, to one, my family was really scared. So after they saw that I had got it, they saw my vaccine card, then they believed in it because then it's almost like they just wanted to see what would happen after. So after they experienced me taking the vaccine very seriously, then they also they ended up getting vaccinated too. I remember too at the time I was also traveling to Mexico and I needed to have like the vaccine and also my vaccination card. So I've always carried the vaccination card with me, and then now we have it available on our phone, so you can put it on your Apple Wallet. So I've been up to date as well with the vaccine, the flu shot, and just staying safe as much as possible.
Thank you so much, Jasmine. Yeah, we know there's, especially in recent years, there's so much information going on like online around the vaccine, and it's hard to know like what's rumor and what's fact, because some of the things like going around like sound pretty scary, but how do you know if it's true? So that's why we have some Riverside public health professionals here to answer any more questions that you might have. So we can open Q&A now. So feel free to drop something in the chat or in the Q&A box on the bottom if you have any questions. I see we got a question from Gilda asking if we can please post the schedule for vaccination. Yes, I'm going to send out that link that Danielle shared in a follow-up email. And also there will be some of these resources available on the Starting Over website. That's startingoverinc.org/resources. And also I want to share that for attending this training, you can receive a $25 ARCO or WinCo gift card. Those will be available at the Starting Over office, which I'll put the address in the chat, but we need you there in person to sign the gift cards out. And when you do come to pick them up, you can also pick up one of the kits that we'll be handing out, which include like antibacterial wipes, masks, and hand sanitizer. And we also have kids' masks available. So I'm going to put the address in the chat. Also, this information will go out in a follow-up email. Okay, we got some more questions. Thank you, Conchetta, for your comment. Aaliyah is asking, what are some side effects of the vaccines?
I can go ahead and answer that question. A good question. So with the COVID vaccine, side effects can vary from each individual, but with all vaccines, most common side effect would just be like a sore arm that might last, a day or two. Some individuals may feel a little bit feverish. They might feel a bit tired, a little bit of a headache. Again, very mild and may only last a day or two. But those symptoms just mean that your immune system is working and building that immune response. And so again, but also again, it can vary per individual. So some patients might say they don't have any side effects, they didn't experience anything. So it just can depend, but overall, very common, just maybe a sore arm. You might feel a bit sluggish and tired for the day, but it should only last a day or two. If needed, you can take Tylenol, get some rest. Staying hydrated is what we recommend for any side effects.
Thank you, Kevin. Yeah, for me, every time I get vaccinated or boosted, I like to try to schedule it on a weekend when I don't have to work, just in case I do feel like some of the body aches. But yet. I just take some Tylenol and then I feel good to go in a couple hours. Let's see, we have another question regarding the gift cards. They will be available for pickup at our office in Riverside. I put the address in the chat and I'll also be emailing it out later. We might be able to ship you some gift cards, but we need a way to get your physical signature on the cards. So feel free to give our office a call. You can find our office phone number on our website at the very bottom. And I think we can work something out to get it to you if you're in Palm Springs. We just need to figure out how to get your signature. And we have another question from Conchetta, which is, if you are immune compromised, do you get the same treatment as someone who is not?
I can answer that. So in order to get the prescription, you have to be seen by a primary doctor or a doctor of some sort. So they'll go over whether you're an eligible patient or not, based off of your immunocompromised, what you're immunocompromised for. So it's always best to talk with a primary care doctor or a doctor in general before taking the prescription. Did you want to add something, Kevin?
No, that was good. Thank you.
Thank you, Danielle. I have a question, which is, like, what is the main difference between the vaccines, and besides like the age that it's approved for, and are there different like effectiveness rates between the, I think, like 3 brands that are available?
That's a good question, and that is something that we do get quite asked quite a bit at our clinics, and there's really no significant difference between the 3 different types and brands of the COVID vaccines. They all have pretty equal effective efficacy, and really it's more so, for example, we may have patients who have had a severe allergic reaction to maybe the mRNA vaccine. So like Pfizer and Moderna, maybe they're allergic to that, but they do have the option to receive the other vaccine type, which is the protein subunit that was discussed in the presentation. And so that was the Novavax vaccine. So that's like another option for patients who aren't able to get Pfizer or Moderna. So that's one thing, one benefit of having the different brands. Another thing too is we've had patients who, let's say they got Pfizer for their COVID vaccine of choice, and then they didn't do so well. They got, they felt pretty sick and, didn't feel good as far as side effects go. And then they decide, okay, maybe let's try Moderna. And then they take Moderna, and they don't experience those same side effects as the Pfizer. So it's just different brands of the same way that they create the vaccines. So there's really no difference from each one, but it's just providing options for patients who are kind of looking into getting COVID vaccines.
Thank you for that, Kevin. We have several questions from Ladon asking, are people with underlying health issues okay to take the vaccines? And Ladon is also asking about like the origins of the virus, and also like safety for children getting vaccinated. Daniela, Kevin, could you speak to that?
Yeah, of course. And, it's, we're glad that there's, questions and concerns about it. So like with the presentation, with a vaccine, they're not providing, the vaccine doesn't have the virus itself, but it has maybe a part. So for example, the mRNA, it's just genetic material that has the instructions to create harmless proteins that then the body will recognize, fight off, and that's how they stimulate the antibodies to fight off, COVID if you were to get it. Then your body gets rid of it. And then as far as for children, they, vaccines for children, not just COVID, but it's very common for young children to receive vaccines because they're still developing their immune system. And so the vaccines are there to help provide that protection for a lot of different diseases that are out there, not just COVID, but for many other vaccines, especially that go around young children. Like, for example, as I know there's news about measles going around. So just like one example of, vaccines are great preventive measures to make sure that young children don't get sick. But in general, vaccines don't have the virus itself, and they're just pieces of it or things that will your body will recognize so that they can fight it off in the event that someone were to get the actual disease itself.
Thank you, Kevin. And yeah, and I think as in Danielle's presentation, the vaccine also does not alter our DNA in any way. And it goes through, the vaccine goes through rigorous testing through the FDA and yeah, basically the vaccine is very well tested before it goes out for like public use. It is not an experimentation on the public because it goes through like many levels of testing before we're able to use it. Right, Kevin, could you speak to like the trust behind what we're putting in our bodies?
Yes, absolutely. And before vaccines ever go to, to the clinics, pharmacies, it's always, there's research and testing that goes on, clinical trials that go into these vaccine creations. And especially with a lot of vaccines that have been around for decades, those have been researched and tested and um been around for a long time. So that builds the trust with the community. So there's a lot of clinical trials that go on with vaccines.
Thank you so much, Kevin. And I see we got some more questions about if you don't have a car or if you live far from our office. We might be able to like ship you the card, but it is a physical gift card, so we can't get it to you electronically. However, I think if you can return like this like a sign-off sheet with your like signature, just verifying that you attended this training, which I can send to you via email. I think we might be able to ship it to you. So I will get in contact with you after the webinar. And again, there will be a follow-up email with instructions for how to pick up your gift card and also all the other PPE and test kits that we have. Danielle or Kevin, could you maybe to close us off, give us like a bit of information about where people can get some of those like test kits and like how to know when you should like isolate and yeah, just at the first steps of when you think you might be getting sick, like what are best practices to make sure you're not spreading it to other people?
Yes, as far as preventive measures, just if you ever feel sick or you're getting sick, stay home, stay home, kind of stay away from others while you're having those symptoms. And definitely as prevention, making sure you're washing your hands. If you're in a crowded area, we do recommend, the masks. And also, if you're in an indoor space, if taking some time to just go outside, get some fresh air, especially if you've been indoors. Um, and those are some of those preventative measures for, COVID. And as far as test kits, um, if you think you might have symptoms and it might be related to COVID, just take a test. And that way it can help you, confirm if you do have COVID. And then if you do end up getting COVID, then, there are those treatment options that were mentioned in the presentation. Um, that we do recommend, seeing your doctor and getting started within the first 5 days of symptom onset. Um, and then just taking those measures, isolating until you feel better, and you're good again.
Thank you so much, Kevin.
Just to add to that, there's I believe it's covid.gov, where each household is entitled to 4 free tests a year, or I'm not sure the time frame on how frequent you can get it, but there is I think it's covid.gov that you can order 4 tests free a year. And then also if we're in need of an immediate test and you needed one, you can always get it at a pharmacy.
Thank you, Danielle. Let's see, to LaDawn and Cynthia and Jalen, if you put your emails in the chat or in the Q&A, I can get in contact with you after to see if there's a way that we can get you the gift cards that you don't have to drive to the office. But we can take maybe 2 more questions. I see there's one more from LaDawn asking about are young healthy males getting heart attacks after taking the vaccine, which I haven't heard of that, but I do know that one of the more severe health effects of COVID that can happen in more serious cases is like heart disease and affecting your heart health. Is that correct?
Yeah, so with that is a good question. And with the COVID vaccine, there is small risk. First, there have been patients that had reported some heart, we call it myocarditis or inflammation of the heart muscle. There have been reports about that with a COVID vaccine in some males. But, compared to those patients who actually develop the COVID virus itself can also affect the heart, and a lot of people, and as well, as we in the presentation with the long COVID as well, can have lasting side effects as well. So the recommendation for the vaccine, it's that it helps. The benefits outweigh the risk. The benefit of being protected with the vaccine to prevent getting COVID disease itself versus the small percent risk that there is for that heart issue that can be reported in some males. So it's a really low risk with the vaccine compared to those patients who have developed COVID and develop heart problems later on with the disease.
Thank you, Kevin. I think we can do one more question, which Robbie, I'll combine these ones. Robbie and Gabriella are asking, what's the difference between the vaccine and the booster, and how often should we be getting the vaccine?
Thank you for that question. And with the COVID vaccine, it's going towards similar to like a seasonal flu shot. So as you know, with a flu shot, it's something that is updated every year for the flu season. And so with the COVID vaccine, it gets updated to help target the current strain that is circulating within the community. So right now, what the COVID vaccine that is out is updated for this year, the 2024-2025 respiratory virus season. And so we recommend patients get up to date with their COVID vaccine. We don't necessarily look at the number anymore. I know a lot of people think, oh, I already got my 2 doses, I'm good, or maybe I got my booster, I'm good. But it's gonna be like the flu shot now, where every year it's gonna be updated, and so we recommend that every year, when it's around the same time as flu season, when the viruses are high in the winter time, that you get updated with a COVID vaccine. So it's like a seasonal yearly thing.
Thank you so much, Kevin. And thank you to all of our participants today who took the time to hear more about the vaccine and the treatment and steps we can take to protect ourselves and each other. Again, I will be sending out an email to everyone who attended And to people who put their emails in the chat, I am going to contact you and see if there's a way we can mail you those gift cards. Again, please feel free to swing by our office. We have so many test kits and masks and hand sanitizers available for you. And again, some of these resources will always also be put up online on our resources section of the site, along with a recording. One more email. Thank you for that. Okay. Thank you, everyone. And thank you to Danielle, Kevin, Lee, and to Jasmine for your time today. We'll be having another session next Wednesday at noon. If you have any more questions, we can answer then.
Thank you.
Thank you.